So, David, it's been a couple weeks since the last time we talked. What's at the top of your agenda?
Well, I'm giggling a little bit here because my gosh, a lot is happening fast here. As we go on to do this recording, we now have some of the top picks for the incoming Biden administration in healthcare. I wanted to do a one quick stop on just two housekeeping items that I think are very important to our members. The first one is, and that is that just recently, for the first time, the government, Medicare, has decided that COVID-19 will now serve as a hardship exemption for people who are filing their information in MIPS. Now, surprisingly, I always thought that probably nephrologists were kind of low in MIPS participation, but we're now seeing that we're really at about 65% of domestic nephrologists are actually reporting in MIPS. It's the biggest reporting program, that quality one in Medicare.
But before you do that, can you just give us the quick one-sentence description of MIPS?
MIPS is one of the two value pathways under the quality payment program where you individually file your various metrics and you either get no adjustment, a penalty, or more likely a bonus.
And what do you mean by a hardship exemption for COVID-19?
Well, they've always had them since they started the program, but primarily the hardship exemptions were usually for places that were, natural disaster areas like wildfires, hurricanes, things of that nature. And so we've kept the outreach to our members fairly focused in those particular areas. They were geographically limited, but this time they're going to allow it to be file for hardship exemption on the basis of COVID-19.
And you were starting to say what that meant for our members.
Well, it could mean that a lot of our members might be able to actually ask for much of their reporting to either be zeroed out or just not included this for 2020. And that also has been postponed. It was due in December. They made this announcement recently, and they've also extended the deadline to take the file by February 1, 2021.
Wow, I'm not sure I expected that. Was that something you thought could happen, or it sounds like you didn't expect it either?
I thought that they might consider it. I didn't expect them to do it quite so wholeheartedly. They didn't really put any restrictions. They basically just said, go ahead and apply now, and then we'll deal with it as we see your application. So yes, it was a bit of a surprise. It was a very good surprise.
I'm struck. It kind of reminds me of people whose kids are who are seniors in high school who are applying for colleges that, for the most part, the SAT, most institutions have waived the SAT. This is kind of a similar thing in the healthcare arena. What's your the second issue that you wanted, housekeeping issue you wanted to mention?
Real fast, we've talked about the physician fee schedule. It was finalized. The increases for nephrologists will be about 6% on average in 2021 starting, and the ones for home dialysis will increase approximately 30%. We will probably be revisiting this issue because there is a battle for some adjustments to be made on Capitol Hill. We'll see what happens.
Do those legislative proposals try to claw back the increases for nephrology and home dialysis, or are those sort of separate tracks?
They don't necessarily try to claw them back. They try to kind of hold off on the overall evaluation and management cut code in the codes because of the fact that E&M coding and its payment is budget neutral. They're trying to not have that happen. In kindness to everyone else in the House of Medicine, ASN has been willing to look at a budget neutrality plan to make sure that everyone doesn't get hurt, but not at the expense of clawing back what nephrology is receiving starting 2021.
That's interesting. So what do you think is going to happen over the sort of rest of the lame duck in terms of either, this legislative proposal or other ones? I'm just sort of curious as to your current thinking on what's likely to happen over the next couple of weeks.
I'm increasingly beginning to think this one's a long shot to be included in the final package because it is expensive. It does come with an expensive price tag. It goes up into the billions. So I'm thinking that it could just, quietly go away. And as you know, and you can tell everybody, one of our longer term, from years and years and years priority, however, may get included, and that's the immunosuppressive coverage, because it's actually been now marked as a cost saver. And you can tell everybody just how long that has been a priority of ASN's.
Yeah, I mean, I started the organization in 2008, and at that time, people were talking about, the decade or so of work on that issue. So, and we've talked about the specifics in the past, but I do think that it's very likely that as part of a sort of CARES 2 package, they will include coverage for immunosuppressive drugs, which is just to get that done this year is just remarkable. And I think, the entire community has worked together on that. And it's something that has been a really unifying issue. So, just credit to everyone. And I'm very optimistic that will happen by, the end of the calendar year.
Well, let's keep our fingers crossed. Now, do you want to have a little bit of fun with who's on first? Because we've got some announcements out to lead HHS under the incoming Biden administration.
Yeah, so there's been a lot of recent announcements, and I think it would be helpful, David, if you could just walk us through as the Biden administration starts to take shape now, and obviously will come into power and by the end of January. What does the healthcare team look like?
Well, and I'm going to ask you guys to help me if I get any pronunciations incorrect, and I apologize in advance. But starting out to head up HHS, well, first of all, President-elect Biden has selected Javier Becerra, and you and I both know he's a big name in Democratic politics and has been the Attorney General of California for the last 4 years. And he will be the leader as the Secretary of Health and Human Services.
He's someone that when he was in the House, he was in the House of Representatives for quite some time and was really seen as a rising star and had always been really interested in healthcare issues and health policy issues and a big supporter of medical research. So, I think he's someone who will likely continue, the progress that has been made over the last, decade plus in terms of HHS's focus on kidney health and on healthcare related issues related to the 37 million people with kidney diseases in the United States.
Yes, absolutely. I mean, he's been a champion for both healthcare and for those who are really affected by disparities in healthcare a lot. And as you said, he also helped champion the Affordable Care Act through Congress and through the House. And he was one of the lead Democrats on the Ways and Means Committee dealing with healthcare issues. So he's going to be a strong force. And he's a really interesting choice because he's also been a Democratic Attorney General who has fought the Trump administration in court more than 100 times in different filings and has led the battle to try to save the Affordable Care Act in the discussions that have made it all the way to the Supreme Court. So he is going to be a thinker in a lot of different ways, not just about healthcare, but how to package it in such a way as to make sure that it can withstand challenges.
Yeah, just to that point, I finally had a chance to read. There was an excerpt from former President Obama's new book that was published in the New Yorker, and it's entitled "The Health of a Nation: How the Affordable Care Act Was Passed." And it's available online, so you don't have to be a subscriber to the New Yorker. It is a long piece. It's probably in this sort of 6,000 words arena, but it's really just a beautifully done assessment. The first half really talks about efforts to bring health coverage to Americans through history, and then it shifts into a real discussion about sort of the process it took from a legislative perspective to pass the Affordable Care Act. And even if you're someone who opposes the legislation, it's still a really interesting read and gives you some insights as to how difficult an issue health reform is, but also just the politics around the issue and sort of how it interplays with some of the changes we've seen in American politics over the last 20 years. It's just a very well done piece. So again, it's in the November 2nd issue of the New Yorker. But if you Google Barack Obama health reform, the New Yorker, it comes up. And again, it's called The Health of a Nation. And just I highly recommend it to anyone who's interested.
It is a really good piece. I do agree with you. And it really kind of goes to one of the points you and I have talked about on the sidelines here, just thinking about this podcast, and I know we'll be doing it some more, which is just basically what the approach of the incoming administration will be. And that whole period with Obama is actually kind of a cautionary tale as well. Obama thought of building capital and kind of retaining it, spend it as needed political capital. And the discussion that you and I have been having about whether that's really a strategy in this current extremely partisan era, of whether or not you can afford to build capital and expect to be able to use it, or whether you really just do just a full blast and try to do anything you can and everything you can as fast as possible.
So in addition to, I think that's well said. And so in addition to the proposed HHS secretary, who are some of the other members of the Biden health team?
Well, Dr. Rochelle Walensky, who is going to take over CDC, and I could have just as easily been happy to also have her take over CMS if that had been the way it had gone. But it's going to be CDC, and she is an infectious disease expert and chief of infectious disease at Massachusetts General Hospital. I was looking at some of her podcast with different people, and she'll be taking over CDC, and she had some really clear thinking. I should be able to post it somewhere about how to think about herd immunity. And so what's really important as we look at this right now, very clearly not impressed, does not think it's a reasonable strategy for the United States, talks about the failures that Sweden had with it, and makes a really strong point that 47% of adults in the United States probably have some comorbidity. So the idea that you could just let young people out and build herd immunity and keep the rest of the population safe just isn't workable. It just doesn't make sense.
I've been struck that it seems as though the ID community in particular, but then other sort of health policy experts have been very pleased with the announcement that she would be proposed to lead the CDC. And I think someone with her background in the current environment makes a lot of sense. So, okay, in addition to Dr. Walensky, what about other members of the Biden healthcare team?
Well, the president-elect has also selected Dr. Vivek Murthy to be Surgeon General, and this is going to be a return role for Dr. Murthy, who has served as Surgeon General before. And I think he's also an extremely qualified candidate and clearly having been Surgeon General before, and I think he will be very much important and useful to the Biden team, and I think everyone is very excited about that as well.
So I've been a little bit confused by the role that Anthony Fauci is going to play in the new administration. My understanding is he will continue to lead the institute at NIH, but it sounds like he'll have additional responsibilities.
I think that the unique role that Dr. Fauci is going to play is also part of the unique times that we're in and the unique role that he has played in the government through multiple crises, through AIDS, through Ebola, through COVID. He's been leading infectious disease efforts for several decades now. He's an excellent scientist. And also there's just a time when I think Biden is saying, I need no nonsense people around me. And he is clearly one of those. So I think he's going to have a really impactful role in both infectious disease and just in general. He's just a very solid thinker about healthcare.
I'm struck in maybe, this could be sort of our closing issue, which is it seems as though what the Biden transition team is doing is identifying people with expertise in two arenas. One is the Affordable Care Act and thinking about healthcare coverage, and then being able to balance the challenges from the left and the right in terms of, an issue for more of an all-payer approach, Medicare for all, universal healthcare on the one side, and then efforts to, if you will, shore up the Affordable Care Act and think about more of an incremental approach on the other side. And then the second set is people who are really expert in managing us through the COVID-19 pandemic, and as we transition into the vaccine, into moving closer to being able to reopen, all parts of the country, people that can sort of think through those issues as well. Is that how you're reading things?
I am reading it that way as well, and I think part of what I find very interesting about that is it's kind of got several implications. One, the idea is that I think that they want teams that are going to be ready to hit the ground running absolutely at breakneck speed to try to bring COVID-19 under control. That is in first, second, and third most priority. They're going to be doing that. And at the same time as that house gets organized, I think they want the team to be broad enough to be able to start looking at how to make sure to protect what is there in terms of the Affordable Care Act, and look at how they can expand coverage into areas, everything from food security to social determinants of health, and using waivers for Medicaid expansion. In other words, they don't want to sit around and wait and ask Mitch McConnell if he's willing to play, with them on various policies. I think they pretty much want to move without having to go through the asking permission phase.
Well, thanks, David. I'm really struck by how many things are happening simultaneously, both in terms of, if you will, closing out this year and thinking about some of the transitional issues as we move from the Trump administration to the Biden administration.
Well, I think that a lot of the the talking heads recently in the political world have been making one point very clearly. This is an extremely different style of president than the president we've had for the last 4 years. I think we will see a lot of change and a very significant difference in how it operates and how it all occurs.